This is a quick nutshell overview. There'll be other videos with more details, but these are medications for asthma and COPD. Most patients that have asthma and COPD can take these same medications, but there are some that, for example, asthma patients don't take, such as anticholinergic drugs. It's just not efficacious for asthma as it would be for COPD. COPD goes a little bit deeper with the impaired gas exchange and damage to the alveoli, much more thickening and secretions in the deep in the bronchial tree, and so therefore they need many times anticholinergic medications to help that. So there's anti-inflammatory medications are the first one here, and those include your cortical steroids as well as other types of anti-inflammatory agents, which we will get into more detail. But here's a couple examples here. Dalaresp is only used for COPD, and it's used for those that, they're on a lot of inhalers and they're not really getting good relief, and that's a pill form. And Xolair is used for asthma, and this is more of a immune modulator medication. It does not cause issues with your immune system decreasing because it's dealing only with the allergic response in your body. Then there's bronchodilators to open up the bronchioles, which is used for both. There's the leukotriene receptor antagonists, such as Singulair, that's used very commonly in asthma and allergies. We have monoclonal antibodies and the phosphodiesterase, which is not used very often. COPD patients, these are the anticholinergic drugs, dry it up. And then we have combination drugs. So we see asthma patients on combination of bronchodilators and anti-inflammatories, such as your steroid inhalers. Which is this one right here, the glucocorticoids, long-acting beta agonists. And then there's also beta-adrenergic to open up the airways, and an anticholinergic. Those are used for COPD patients. These can be used for both. All right, here is an overview of respiratory inhalers. Not just inhalers, but respiratory medications for asthma and COPD. I'm just going to go over this really quickly here. So we have short-acting beta agonists right here. And then you have long-acting beta agonists. Remember beta-2 agonists, you have alpha and beta cells. So these work on the beta cells to promote opening of the airways or dilation of the airways. So you have to go back to what your parasympathetic and sympathetic nervous system are doing. So if you need to review that, go back and review that. So what it does is open up the bronchioles. The short-acting works within 15 minutes. This is your Albuterol. I think most of you have probably heard of Albuterol. These are the brand names. So I determine which one they get depending on what their insurance company wants them to get. Or let's say they don't have insurance, and I'm going to find out from the insurance company which one is the cheapest. But these are all the same. They open the bronchioles. Then we have the long-acting. They're really not given alone anymore. If you're going to see it, it's more for COPD given alone, but studies out there have shown that it causes mortality if you're taking a long-term beta agonist, if you're overusing it, I should say. So it's not used in asthma as much. What they do, though, look at the next line, you have your cortical steroids. Remember, that reduces inflammation. Again, which one am I going to pick? It depends on what the insurance wants. So every patient that has moderate to severe asthma is going to be on cortical steroid, but everybody that has asthma has one of these on hand. Because if they have a trigger that triggers and they need something to open up their bronchioles right away. So they could have one of these on hand and they'll always have this on hand. But what happens is many patients say, well, I'm taking one of these medications. Let's say that they're taking Qvar, because that's a common one. Qvar. and you take QVAR once a day. Most of these you will take once a day. Some you take twice, usually once. These patients don't notice any difference because it's working slowly to reduce inflammation. You're not getting that instant open up your airway relief like you do with the beta agonists. So what they've done now, well, it's not now, this has been around for years, is they take the short-acting plus the long-acting equals combination medications. So if we look here, these are all your combination medications of a cortical steroid here plus a long-acting beta-2 agonist. And if you take it how it's prescribed, then it will be safe. But with any medication, with these, we want to be on the lowest dose possible. So these patients a lot of times are going to be in your Advair, or there's Briolipta, Dulera, Symbicort. These are used very commonly with COPD and asthma patients. We will go over guidelines in another slide set. There's also muscarinic antagonists. These are used for COPD only because of the mechanism of action. These are your Atrovent and Crucilipta, Spiriva, Respimat, Tudorza. These have been out for quite a while. They do the same thing. Again, it depends on the insurance and what's going to pay. But let's say someone's resistant. That's when we go to these biologic medications. And these are used for asthma, patients that have severe asthma that are not responding to these treatments. I'm not going to go into bronchial thermoplasty or, I'm not going to go into that one. The Dalaresp is used for COPD, which we will go over in another slide. But this just gives you an overview of how many are out there. And when you are a prescriber, you have a few that are kind of in your arsenal, I call it, that you prescribe most often. But again, you'll get used to what insurance companies cover, if like I have state Medicaid patients, and it usually changes every 3 to 6 months, sometimes quicker. For example, QVAR's on their formulary, and so is ProAir. So that's what they want me to prescribe. So that's what I'm going to prescribe. It's usually playing the game of saying, all right, I'm going to give you an Advair, and the pharmacy says, no, it's not covered, and they send something back to me saying it's not covered. Then I have to pick a different one. All right, let's try some Dulera. And then they say it's not covered, and we go on and on. So I try to get the pharmacy to say, you need to give me a list of medications that's covered, which is beneficial for the patient, so we're not wasting time going back and forth and for their treatment of their asthma or COPD.